6C. This is my project for neighborhood journalist for e-benefit. Today we are going to talk with Mr. Anand Prasad. He is a doctor. So let's start. Namaste.
Namaste, Sherin.
So today I am going to ask you some questions.
Okay.
So our first question will be, how did you cope with the pandemic?
Yeah, it was a difficult situation. Nobody expected it. It came all of a sudden, and the researches are still going on. Not only the doctors, all the public, the health personnel, the police, the sanitary workers, and many people. They are the frontline workers. They are working round the clock to protect the people, to save the human life, and it's a hard work. And we hope that we find the light in the end of the tunnel. Hope the pandemic ends soon.
Okay. The second question will be, what did you do different during the pandemic?
We had to spend the whole lot of time in the hospital taking care of the patients. Any country is devoid of the manpower to take the healthcare personnel to take care of the patients. Nobody expected these many number of patients at a particular point of time. Sacrifice our personal time. The kids, the family. We had to stay in the hospital, leaving them behind. Yes.
The next question will be, during the pandemic, did you do any kind of social service?
Like we were taking care of the patients. The mode of treatment totally changed because the patients weren't coming to the hospital, so we had to go for a telemedicine services. The telemedicine service boomed all of a sudden, and patients used to call even in the midnight, and we need to cater their needs. And yeah, it was a difficult task, and yes, we continue to do it.
Did you help your friends or family when they contracted COVID-19?
Yes, definitely.
Then the next question will be, do you remember any inspiring gestures or activities of your neighbors during the pandemic?
Particularly the second wave was so very different that it was not just a single person in the family falling sick. It was the family altogether falling sick, and there were incidences when both the parents, the elders, fell sick, and the kids were all alone. And yes, the near and dear ones, the neighbors and the friends took care of the kids. That was one of the good thing. And
what do you do in your free time?
from working, I like driving. So I drive a long distance. I used to take care of my kid, and I used to play with music.
Okay. Can you tell us something about COVID-19?
This coronavirus has been existing already. It is not new to the medical community. One of the zoonotic diseases is common among the animals. But what happened here is the virus had to jump into the human community. One bad thing about this corona is it's highly infectious, and it's a viral illness. Okay, so it's just taken many phases now. And the strains are mutating, and we are sitting on the verge of the third wave.
My next question will be, there are many diseases such as Chickenpox that are also viral diseases.
Yes.
But people were able to control it. Why is it not the case with COVID-19?
Okay. See, there were so many viral illnesses, as I was telling you. Not just the COVID-19 or chickenpox or smallpox. There are incidences wherein certain viral illnesses like smallpox was totally eradicated. But in COVID-19, early stage of knowing things. And it is going to take some time for the scientists, the doctors, the medical people to understand the normal progress of the disease, to contain it, and of course, the vaccination was one such initiative. But COVID-19, as you know, has been announced by the World Health Organization from pandemic to an endemic. Endemic means at some point of time it will come and go, like dengue. Dengue used to come in a particular year, and then completely vanishes. Come the next year, and so on. So COVID-19, you can also expect it to come again and again for a while. And the best method is to follow proper sanitation, wear your mask, and what? Social distance.
Social distancing. Okay then. How many COVID patients have you treated so far?
I don't have particular numbers, but it should be more than 200 or 300. Yes.
Okay. Last but not least, what precautions will you make people aware about COVID-19?
Okay, distancing and wear your mask, follow proper sanitation. If you follow all these three, all these steps also is going to prevent not just COVID-19 but also other infectious diseases. And this is on the prevention part. On the mentioning on the therapeutic part, people need to be more cautious. They need to be more aware, and whenever you fall sick, report immediately to the hospital because prevent death.
Then, thank you very much for taking some of your working hours and hard time for us. And thank you for answering all those questions nicely. And thank you everybody for watching this video. This is Sherin from 6C for the benefit. Thank you.
Thank you so much, Sherin. It was a pleasure being with you.
Thank you.